This is Georgia. How you doing this morning?
Welcome to the Dougherty County Board of Commissioners meeting with your chairman, Christopher S. Cohilas. Your commissioners include, from District 1, Commissioner Ed Newsom. From District 2, Commissioner Victor Edwards. From District 3, Commissioner Clinton Johnson. From District 4, Commissioner Russell Gray. From District 5, Commissioner Gloria Gaines. And from District 6, Commissioner Anthony Jones. Also joining us is your County Administrator, Michael McCoy, Assistant County Administrator, Scott Addison, County Clerk, Joanne Ware, and County Attorney, Spencer Lee. Thank you for joining your Dougherty County Commission meeting.
All right. Good morning, everyone.
Good morning.
Good morning.
All right, let's go ahead and call to order the Dougherty County work session for March 29th, 2021. We'll start with roll call. A note for the record that Commissioners Gray, Newsom, Edwards, and Johnson are present in person, and I'm going to sound for Commissioner Gaines and Commissioner Jones.
Yes, good morning.
Good morning, Commissioner Gaines.
Good morning, Mr.
Good morning,
Good morning,
Commissioner
Mr.
Jones.
Chairman.
All right. Very good. All right, we've got a fairly involved agenda today, and we've got quite a number of delegations, some of which are on the printed agenda, and some of which I've been made aware of. So I'm going to try and find a way to move us efficiently through this agenda. But let's start first with the first item, which is minutes. Consider for action the minutes of the March 1st regular meeting and March 8th work session. Is there any comments, questions, or discussion on that item? Forward with delegations. This is where the commission will hear comments of those items pertaining to Dougherty County for which public hearing has not been held or scheduled. We ask everyone to be brief, to the point, and considerate of time for others. And on my agenda, I've got four separate delegations, and then been informed that there's one other presenter that is associated with item A, and then another gentleman, Mr. Murray, who is here to speak about community homes. So what I'm going to do first is move through the items that are on the agenda, and I understand Mr. Mathis is here with Dr. Uzoma Okafor on behalf of Albany State University and fellow associates who are present to discuss the Crime Lab degree program and future projects at ASU. What I'm going to ask everyone to do, I'm not going to hold everyone to a strict timeline, but I'd like for us to try and keep each delegation to about 10 minutes. Not, obviously if we need to discuss more than that, that's fine, but just trying to find a way for us to get home or finish this meeting at a reasonable time, because we do have a significant amount of work to do today. But let me call first my friend, Mr. Mathis, please.
Mr. Chair.
Yes, Commissioner Gaines, good morning.
Yes, thank you.
I think that's a very good point, Commissioner Gaines, and duly noted, and perhaps I should have vetted the agenda a little bit more rigorously, but I think we can get through it today, but your point's well taken and much appreciated. All right, thank you, Mr. Mathis. Good morning.
Yeah, good morning, Mr. Chairman and the degree program and future projects at ASU. Several months ago, Mr. Chairman, even maybe dating back until the latter part of last year, I began to meet with the city and county public safety department And the reason for that meeting was to talk about how Albany State University could interact with both the city and the county public safety to help expedite and address the criminal justice issues in the city. So as a result of that, we began to meet at the police, the city police department, and of course, your chief, Chief Johnson, and Chief Persley was in attendance, as well as some of my colleagues from the university and a couple of other individuals from the community. So we discussed how we could go about bringing Albany State University and the county and city together. And as a result of that, we explored a number of different areas where we could work together, one being the crime lab. And it was discussed at some future date, we would invite the county commission as well as the city commission over to the university campus to look at the crime lab and give some input as to how that crime lab could work in conjunction with the crime lab, potential proposed crime lab here in the city, as well as working with the coroner. So as a result of that, that meeting took place over on the campus, and some of your colleagues here from the county and city was able to visit the crime lab and go through it and look at it and see. And then there was discussion held, and we also was informed about potential funding that could help with the joint venture between the city, county, and the university. So as a result of that, we're here today to make that presentation. Dr. Ophirkle will make it, and he will discuss crime lab, the degree program, and future projects at ASU. And also at a later date, we will come back after having met with the coroner and my colleagues from the criminal justice department. We would then come back with recommendations with the coroner's input into how we can best have the crime lab to be a state-of-the-art crime lab with the different personnel that you need, working and how those personnel will be funded. And I think this morning my colleague will probably address some potential funding possibilities that will help aid us and guide us along that way, so that it would not require, if any, funding to bring in scientists and other professional people into that particular proposed crime lab. And in addition to that, we're hoping that it will be such a state-of-the-art facility that it will serve Southwest Georgia, which means potential income for the county and for the crime lab itself. So given that the nature of what's going on now out there with crime labs and the time that it takes for city public safety and county public safety, more city than county to get certain results back, the crime lab will be able to assist in that, so it could help expedite the time it would take to get evidence base back to the respective public safety department. So that's where we are, and that's how we got to where we are today. And so now I also want to thank, before I call my colleagues up, I want to thank my commissioner, Commissioner Johnson, and Commissioner Edwards, who took point on this. And Commissioner Edwards, he sort of took a little more leeway, I would assume, with the support of my commissioner, Commissioner Johnson, but they both worked together with us. They were both a part of the conversation that we were having, and we want to thank both of them for bringing this to the body and getting it on the agenda so that my colleagues can come before you and discuss where we are. And with that, Mr. Chairman, I'd like to now call on my colleague to come up and speak on behalf of the rest.
Thank you.
And thank
As
you all.
always, it's good to see you, Henry.
Always good to see you.
Dr. Okafor?
Yes,
Did I
sir.
say that correctly?
Perfectly.
Good, very good.
Yeah. Good morning, Chairman.
Good morning.
Good morning, City Council. I want to thank you all for this opportunity to actually showcase and bring forensic science at ASU to the city formally. I think this will be the first time this opportunity is given to us. This is a facility that worth over $5 billion. We have the equipment, we have the manpower, we have the students. Where did we start from? We have a mission to train students in Southwest Georgia into workforce to serve as forensic scientists, crime lab managers, and CSI investigation. We've been in the city since 1997. We are the only school, the only program in the state of Georgia that is fully accredited by FEPAC in the USA. Mind you, there are only 13 programs in the whole United States of America that is fully accredited. So we have a program that is formidable, strong, and still getting better. So the first accreditation we got was in 2007, over 13 years ago. We've got some grants, some funds, over a space of 10 years that worth close to $2 million that has funded our lab. And we have our lab with strength that is capable of helping the city police, the county police, and other law enforcement agencies around Southwest Georgia. We have forensic ballistic lab and trace evidence that works solely on guns, fingerprints, fibers, with state-of-the-art equipment. We have forensic chemistry, drug, and toxicology that works solely on controlled substances. We have forensic biology lab with state-of-the-art equipment also that works on DNA and other body fluids. This can be a good way to form a synergy between ASU and the city or the county generally. Our skills include our students engage themselves with internship, 25% research, and 70% of them do proceed to graduate school. Where do they work? Most of them work around the city of Atlanta. Some work with GBI, some work with the Security Service and FBI. I would like at this point to mention, which is worthy to mention, Mr. Fowler. He has been a strong supporter of our program. He has offered so many internship opportunities to our students. Thank you, sir. And why am I here? To discuss Forensic Science Center that can benefit the city. One of the major problems with crime solution and solving is the backturn or the turnaround of evidence analysis, processing, and getting it back to the court. This, I know, has been a very big problem to NIJ itself. One quick way we can do that is to form a collaborative effort between ASU and the city. And one way we can do that is to use or to harness the expertise at ASU, the equipment we have, our student body, to help train and analyze crime or crime scene evidence with a very fast and unique turnaround. If we can get that done, it's going to be cost effective to the city. I'm quite aware right now the city do send their evidence to Vadosta, and that will take some priority before it can be analyzed or done. One other way we can form a synergy is through grant writing, which I'm going to discuss in detail. So some of the advantages of having this synergy is that we have an improved average turnaround time of evidence analysis and the result and the processing. We reduce the backlog of evidence, and training of officers will be one priority that the center can also take into cognizance. We also try as much as possible to provide support to other agencies around Southwest Georgia, thereby making money. They submit their evidence to us, we analyze, and we charge, which Fadosta is actually gaining ahead with. Also, the Crime Life Center will also provide some mentorship programs to ASU students. That means we want to keep our students and our children back home. That will increase and it will reduce the attrition and the number of crime committed within the city. And it will also encourage civilian specialization. That is, the crime lab technologies, they become specialized.
Let me stop you right there. When you say encourage civilian specialization, what does that mean?
Yeah, I mean the crime lab technicians, they are civilian, they're not sworn police officers.
Okay.
They become specialized in whatsoever they are doing.
Gotcha.
So where is the money coming from? There are a lot of grants that we can partake on and make some comparative advantage, being historically black institution and the level of crime in the city. We have the NIJ, which is National Center on Forensic Science. Last year, they spent over $2 million award to various universities and in partnership with service or state or county. We have,
This was already awarded to ASU?
no, this was last year, not to ASU. This was awarded to another county in Texas. Because we have no leverage, we can't compete for such grants. We have research and development in forensic science for criminal justice purposes. That is about $4 million worth of grants that we can actually partake and compete for. We have the Paul Coverdell Forensic Science Improvement Grant. That's about $50 million that we can also have some share from. We also have National Youth Gang Survey grants, about $1.5 million worth of grants that we can also apply to gain some leverage from. And I believe with the synergy, having a lot of professionals at Albany State University, with the level of crime in the city, most of these grants, we can easily position ourselves to gain and to get and to apply for it in due time. Thank you.
So let me ask a couple of questions. And I say this as a former prosecutor, very familiar with the equipment that ASU has. I also know our district attorney, my good friend Greg Edwards, is here. And I'm assuming Mr. Edwards is here to view this, or are you here for other business, Mr. Edwards?
I'm here with the commissioners to give my observations again.
Okay. Did you have some observations? I'd like to hear from you as well.
I will.
Yeah, if you don't mind, I'd like to hear from you first, and then before I ask any questions, because I suspect you'll be able to answer questions from my mind as a former prosecutor. So.
Well, I'll begin with the notion that I have certainly supported the notion that Albany State University should have a crime lab to facilitate doing work around in this general Southwest Georgia area. I've been a supporter and advocate of it
Sure.
literally for years. In fact, there are a couple of things that are necessary in my efforts to try to get this going. We got to have a facility that is secure for evidence, maintenance, and security. That's the number one thing. Second
That was
thing,
question number one I had.
yeah, that's the number one question, security of evidence, because literally you can have thousands of dollars of drugs and other things that are there.
Millions, yeah.
Millions of dollars, even in Albany,
Yeah.
of drugs and things that could be accessed by somebody wanting. So security, certification by all of the requirements of, now the GBI has certified nationally, and so when, again, seeking information about getting ASU certified, got all of these and all these alphabet soup certification requirements. They have to be, of course, met, and so those are the second requirement. Third requirement is kind of stability of personnel. I mean, I understand, you know, that you have professors that will be working in the crime lab, but will they be doing that and teaching? And again, stability means having people that's going to be there. It's a very volatile business, crime lab, personnel in these laboratories. That's why the GBI is losing personnel for more money going out in the private sector. So stability of personnel, security, and certification. Got to have those three things. In my early efforts to try to get those things done, the ideal situation presented itself when the former Naval Air Station infirmary was available. And actually I was working with an individual, he was a professor from the University of Nebraska, who wanted to combine hard sciences, forensics lab, and a morgue at that location. But we were unable to get to, it was sold to private entities, and that would have been the ideal location. It has to be apart from the campus. It could have been secured. It had facilities where a morgue could have been put in. So those are the things you got to accomplish with this effort. So
let me ask this. You were drilling down to all the things that I was thinking about. One, it's problematic to, one, you want to create the experience for the students, but you also have to be mindful. You don't necessarily want an unsecure evidence locker that holds a whole bunch of marijuana on a college campus. That's just generally not a good idea to do that. So you're talking about that and the need for it to be
right. The site should probably be off campus.
I would agree with that.
So they can be secured. I know that maybe the notion is that we're building a morgue. If that's something, I guess, I don't know, combined facilities, something like that.
I think that's part of the conversation that we're trying to have.
Yeah.
Yes, sir.
So that would be, like I said, a facility purpose-built off from the campus might be the best thing to go with security and other issues.
It seems to me that if you're going to have, you have three different pieces. We've got a morgue that's going to be coming to Albany no matter what. We've made that decision as commissioners and as citizens in terms of SPLOS. That's an opportunity. Like, that's going to happen. There's going to be a secure facility. I'm thankful for Mr. Fowler, thankful for our community on that. That's one component. The secondary component that I've heard from my commissioners is there a way we could enhance that community asset in order to create additional partnerships? And so what I'm hearing here is there's the potential for a partnership between ASU, local law enforcement, for purposes of a more state-of-the-art crime lab. That then raises different complexities, which is who's going to own the facility, who's going to operate the facility, who's going to hold the certifications, who's going to make sure that it's managed in a correct way. And I agree, all those things can happen. My point is, I think you have to get the right people into the conversation, which it strikes me in my mind, one, Albany's very fortunate in that it has a regent here in our community, Barbara Rivera Holmes, which is a huge asset to have for a local university. So that's one. Secondarily, I would want the GBI to be part of the discussion because the GBI knows all the certifications. It has a standardized way of doing things. You don't have to reinvent the wheel. And I'm also familiar, Greg, what's the backlog right now look like in terms of GBI testing? Is it
well,
big?
they try to prioritize things. In fact, our structure of settling cases, when we have cases that we settle, we try to immediately let the GBI know that they don't have to do the testing.
Right.
That is required for the various cases, forensics or drugs or DNA. If we settle a case and they haven't gotten to it, let them know so they won't have to put it in their stack. And so that's been the process since we've been created this backlog.
And I remember, I mean, back during the years when Governor Perdue was in office and there was times were tight. We remember those years. The backlog on rape kits was anywhere from a year to 2 years, which is an extraordinary amount of time in terms of turnaround. Then I remember, things changed. GBI got some additional funding. They got some raises. The turnaround time, I think, moved to 6 months. But
if I may add, there was at one point where the backlog was so bad they were farming cases out to private laboratories.
Correct.
And then we encountered a problem, like I'm mentioning, about volatility of personnel, because people would leave the different.
And then you couldn't find the people.
Couldn't find the people that worked in the private labs to come back and testify.
That's exactly right. So, it seems to me like the concept seems great. I'm all for the concept, but it seems to me though that some discussions need to happen between ASU leadership, Regent leadership, and GBI to make this more than notional and conceptual, and see. And I'm happy if y'all need me to write a letter or make some phone calls or do what have you in order to create some opportunities within the relationships that we have. I'm happy to do that. So. Is that what y'all are looking for? Because I mean, in terms of the county stroking, $1 million a year check, we're not in a position to be able to do that. But I do think that with
I want to ask a question at that point.
Yeah.
Dr. Okafor, you made a comment about having leverage when you brought the grant screen up.
Repeat that?
When you brought the grant screen up, you said something about having leverage to apply for those grants.
Yeah.
Can you just talk more about that and how Dougherty County can help in that aspect?
Some of the leverage I'm talking about is the crime rate in the city. Most of these grants, we give it to highly volatile county or city with very high crimes. Mm-hmm. And we know we have a lot of diverse type of crimes that exist within the city already. And as DA rightly said, one of the major issues is backlog to bring this case to court. You need this evidence processed, right? Mm-hmm. And with that, and with the position of forensic science in Auburn State being fully accredited, what we do right now, because we don't have any city crime lab, other crime labs that want to apply for such grants, contact us to write a letter of support for them. The program does not merit or gain anything from that than having that pathway to send our students for internship in those cities. It has gone as far as Iowa State University, contacting us to write letter for them to support, and they got $5 million.
So you write a letter of support for them, and they end up receiving the money?
Receiving money.
So how do we help you receive the money at ASU?
You must have the structure.
Okay, a facility.
The facility on ground.
Okay.
This is the facility where this program will be handled. If that is not there, because it's a partnership between public and the university.
So in theory, if we were to provide space for the GBI, for ASU, what do you call it, FSC?
Yeah.
If we provided space in our morgue for your equipment for that facility, you could bring down grants for.
We can bring down a lot of grants and a lot of trainings invite some FBI, some GBI personnel to also train other police within the county, within the southwest Georgia, mm-hmm. even within Georgia.
So in theory, it can be a training facility more for forensic science, so on and so forth, if you had a facility for it.
It's a win-win situation for both parties.
How much space are you talking about?
It depends on how big you want to go. I cannot actually pinpoint how much space, but if you are talking about 3 areas of forensic science that are key to virtually all investigation or any type of crime being committed, being drug, homicide, or just ordinary gate crashing, okay, you will need a ballistic lab that deals with guns and other artilleries. That ballistic lab can be also manned with the same people on trace evidence We already have AFIS at the county that works on fingerprinting. We will need forensic chemistry that will work on toxicology and other drugs. Then, well, forensic serology.
How many students do you think you all are producing per, I guess, graduation period?
A minimum of 20 students.
26?
20
20 students?
on the average.
That's good, okay. And most of them end up going to other programs, other places?
They go to other places, and we have only one student that works within the county right now. She works with the fingerprints with APD.
Thank you.
Mr. Edwards, I know you've been working on this and have had some good input and good thoughts and ideas, and I'd like to hear from you, please.
I appreciate that, Mr. Chairman. I'd like to appreciate everybody for coming this morning. I guess the reason I wanted the presentation to be made, and specifically, was because we're in the process of building a morgue, that don't rush it where we find the right space. Whether we gonna build it on 1 acre, I just didn't want to say, I want a place where we can build it where it has the potential of adding on. So if you, right now, we have that location instead of building it on, I don't want us to jump and put it, I guess the public works site. I want it to look where, whether we do 2 acres, 3 acres, where whatever we build a morgue, based on the funding that perhaps might come down the line, that we can add on to that facility. So that's, I didn't want us to landlock ourselves. So that was, for me, the urgency of wanting to bring it to the full commission attention. If we have an opportunity now, and even with the professor saying we will get some grant funding to help us with the construction piece. But if we built that building, since we're in the initial stage with, with our architects now, let's have that discussion about not rushing building that more. That's kind of, and I think we talked to the coroner said, hey, I'm patient enough to build the correct facility. Yeah. So really that's where I am with what I want to bring to everybody's attention. That we don't have to just jump out and build a little small place, because we got to build a building that's going to last for like 50 years down the road. So let's just don't lock ourselves into that. And I think to y'all, so the case in point this morning was, let us reconsider of not rushing those sites that I guess that we've already discussed, with the corner. Because I don't feel that we going in this direction, that one particular site that the architect is looking at. Okay. So you get what I'm saying? I don't want to lock myself.
I totally get it. I've got an idea. I'm waiting on some information from you.
You'll give me that idea? Now. Well, just like I said, we have all this land we developed around there by Tier Park. We got the National Guard Armory site on the other side. One thing like the district attorney say, once you start building it, we can actually make sure that security is there. The certification piece is going to be upon Albany State. My thing right now as a county commissioner, as this board, let's not rush and build that particular site.
Mr. Chairman, may I weigh in on this a second?
Yes, sir. Yes, sir.
Well, of course, the commission knows that under the Constitution of the state of Georgia and under the general statutes for the state of Georgia, you are able to provide services that you are authorized to do under those statutes and under the Constitution, and this certainly would be one of them. But it seems like to me that the request needs to come from the DA's office through the budget. And if he wants to make a proposal that this is needed, of course, the DA's outlined to you exactly what needs to happen here. You have to provide for the security, and you have to provide for protection of the chain of command. And if the DA feels like that all of that is done, and of course Albany, then the DA can make a proposal and get it in and present it to the budget committee. That's the typical way that it would work, and then y'all can analyze it through the budget. The other part of it is, of course, Albany State's providing the services. They're in the sense that they've got this program where people can sign up for it, students can be educated. There's a lot of differences, everybody knows, between educating students and providing chain of custody.
Sure.
And also security. DA's office is responsible for litigating all of these cases, and if there's a challenge to the chain of command, chain of custody, or a challenge to the security that's been provided, He's got to deal with that issue.
I think, I'm sorry? Oh, I'm sorry.
No, go ahead.
No, go ahead. I just had a thought. The thought that came to my mind was, doesn't the University of Tennessee have what's called the body yard?
They do.
And that's what pops in my head. Now, I'm not saying at all that that's what this is,
Right.
because I don't want people to think that folks going to the morgue are going to be tested or whatnot. But that's the image that pops into my head is
Mr. Chairman?
there's a way to do what you're talking about.
Well,
and it's not like it's a novel idea that can't. It's not crazy. It's very reasonable. Is what I'm saying. I didn't mean to cut you off.
If you permit me to just talk on what you just mentioned now, we have the Texas Public Safety Department, right? You can Google it. All what they do is all about forensic science and evidence analysis. From their director down to their scientists, they are also professors at Texas A&M doing forensic science. It's a synergy that will save cost. You won't be paying overhead. Albany State is already paying this faculty salary, right? If that collaboration is ineffective, they are mandated to work on those evidence also, and also train other students that will take their position later on. It's a win-win situation, as I said. But the key thing that was mentioned, which is quite important, security, certification, and volatility of staff or scientists living or staying in that. The first thing I would like us to consider is the concept. Is there an idea that can be done? Will it save costs? Will it save the city? Will it improve crime? Will it bring down crime rate, or will it increase crime rate? What do we want to achieve as a city? That is the first thing. If you can conceptualize that idea that, look, if you have this going on, right, the turnaround rate of evidence processing will be high. We will support and reduce the backlog of evidence. Right now, the DA's office collects evidence every day, and they have a way of securing these evidences. We have other people that are not certified police officers, that are just civilians working there also. They can also take those evidence and contaminate those evidence, or use those evidence, or destroy those evidence without knowing or knowingly. Those are issues. Those are ethical issues. But once you have this kind of center, first thing you want to talk about, there must be a chain of custody, as you rightly said. And that chain of custody is not in the hand of the student. Okay. Anybody that is handed over that position knows his job, his life depends on securing those evidence. Forensic science doesn't work like any other scientist laboratory, whereby you just go somewhere and pick something and start analyzing. You sign, you date, you stamp, and somebody else will have to verify the amount of quantity you are taking. And that goes on and on and on. On the issue of certification, ASCLAD, which is the only body that certifies all crime labs in the United States of America, I've been in contact with them. There was a period we planned to certify the forensic science lab, so we can serve as a private lab and get evidence processed from GBI, work with some other county, and they tabled all the requirements necessary. But then the school does not want to go that direction because it's a public school. They're not supposed to make money from such evidence. But one thing I'm so interested in is seeing my students having a first-hand training from certified officers, law enforcement agencies, having that, that pathway for them to go into the system after graduation. I don't want a case where my students will train 4 years at ASU, drink the city water, use the city light, enjoy everything in the city, and somewhere in Atlanta snatches he or she to start working there. The probability of them remembering where they begin from is very low. We have a lot of students that have graduated in the past that are fully certified, trained forensic examiners, crime lab managers in various states. If you call them to come and give talk to these students, it takes a longer time. But if you have them at home, you know, the school improves, the program improves, and the city gets what they want.
Sure. Understood. Commissioner Gray?
Yes, thank you, Chairman. I think there's a reason you don't see a competitive forensic science laboratory on every corner, and that's because they're not commercially viable for the business they do. There's not a public market for that. While I think it's absolutely imperative students get hands-on training in a laboratory setting, because the academic side of this, reading about it in a book and doing it, are two completely different things, because the expectation is that you'll be able to do it when you graduate and get a job. I think the GBI has the lab for a reason. I think they know how to operationalize it and make it economically viable for the budget they work under, but it's still not a commercial entity and probably is not going to be a long-term moneymaker. My fear is that, giving an academic center a commercial operation, it's based on throughput. You can't live off grant money forever to operate this lab. You have a high degree of entry-level staff turnover, so you never really gain the institutional expertise and experience that a true off-site lab would be. And I think if the best scenario is kind of what Commissioner Edwards suggested and what I brought up when we talked about the morgue, is have a discussion with the GBI, see if they're interested in having a transference of their crime lab here, if we could provide a better or newer space under our morgue footprint, if we can tweak some designs and make a good partnership there, then it becomes a local source of operations for your students to integrate and work hand in hand in and with both trained forensic professionals as well as the academic side with Albany State. Entities like Tennessee, they don't do it for commercial viability. They do it because they're a academic research center in forensic science or biological sciences. And so that's why they have the renowned, the body yard and other facilities too. And I encourage, Albany State to look at developing a specialization niche around some sort of forensic science, so that other forensic labs may want to refer that part of their science, if they're stumped or limited in their capacity, refer it to you for your expertise in that niche of forensic science, and likewise, have a relationship there. But I would be a little uncomfortable just having even working through plans to anchor it under the university and have the university run a sideline business under their umbrella. And I think what's best for the program too is to have a standalone entity that you can really merge with and work hand in hand, just like Phoebe with their new lab with all their hands-on body dummies and experiential learning with the nursing students. I think that's a similar scenario.
Yes.
Yes, sir. Go ahead, Dr. Okafor.
Okay. Thanks, sir. I would like to correct a notion here. I never heard or said that this will be controlled by ASU. And one other notion I would like to also correct is that I never believed my reason of coming here is for us to make more money. I'm student-centered, and I believe in my students. One thing you mentioned that I also like to correct is that there are a lot of private forensic science crime lab out there. LabCorp is one. Mm-hmm. There are a lot of doctor's office that do forensic science work right now. There's forensic toxicology labs out there. What I'm saying is that we have a program that is formidable, that has everything you need. Why go to GBI? GBI is a state. right? And they have jurisdiction everywhere. They can go to anywhere within the state of Georgia. But there is one thing that they will do also, is the number of students they're going to give internship to will be based on the number of universities in Georgia doing forensic science or not doing forensic science. We have our students that work or do internship in GBI. GBI can only give 8 students internship in 1 year. And the reason is budgeting, as you rightly said.
Well, maybe you can get some examples of other forensic science programs that have started a, forensic science laboratory, under their own business and entity, and bring us examples of that.
There are a lot of them. University of Central Oklahoma, they have a forensic science unit that works directly hand in hand with the city of Oklahoma. They work with their digital forensic science. That means anything that has to do with the computer, with the phone, is submitted to the
I'm sorry to interrupt,
Yes.
Dr. Okafor.
Yes.
Good morning. My name is Gloria Gaines. Is it possible for you to kind of, because I consider this an introduction to the concept, is it possible for you to kind of tell us what you propose is the next step in this process? Who's going to be in the room, who needs to be in the room, and what we should expect to hear from you next if you're proposing a next step?
Okay, thank you very much, ma'am. The next step is to contact my superior at Albany State University to bring them on the table along with other team members. I'm looking at the place whereby I'm actually in discussion with the dean, my chair, Dr. So, is rightly here. The chair of the criminal justice is also here. So we only have about 3 steps in chain of command that need to join the team. That is the dean, which I've also discussed with. The provost is a win-win situation for her. I've discussed with her, and she has given me the go-ahead. She even advised to look at some other areas that the school can work with the city in. So we can bring those people on the table, and maybe the legal department of ASU also come to the table and discuss and draw out what plan it's going to be like.
So here's, in the interest of efficiency, and unfortunately my concept of 10 minutes kind of went out the window, but that's okay. Here's what I'm going to propose. We've got disparate concepts, none of which are mutually exclusive, that are all out there. We have the concept of morgue. I understand Commissioner Edwards' concerns and Commissioner Johnson's suggestions and Commissioner Edwards' suggestions. I also am mindful of the fact that our budget for the morgue is rather limited. It's not a multi-million-dollar budget. I think what we have allocated in SPLOST was $450,000, which may sound like a lot of money. It's really not in terms of building a facility from, laying bricks and building foundation, et cetera. So that's one issue. There's the secondary component of a potential partnership between ASU and city and county entities, maybe the GBI. At some level, that's sort of a public safety issue. At another level, it's really a government affairs, a government relationships issue. Here's what I'm going to do. I'm going to refer to the Government Affairs Committee the issue of exploring a potential partnership with ASU, city, county, GBI, et cetera. I'm happy to do whatever I need to do in order to help open some relationships. It seems to me that this is a conceptual concept. It's a good conceptual concept. We got fork, knife, plate. We don't have any steak. So that's, you need a steak in order to have supper. So that's figuring out how we're going to find a steak is another thing, and whether or not this is actually feasible or not is another issue. I also am going to ask that Mr. McCoy have staff at a future work session provide us with an update on the morgue issue. I also want us to be mindful of the fact that to a certain extent that contemplates potential real estate acquisition. What we don't want to do is have a discussion that goes into too much detail potential sites, because that can actually drive up the marketplace. If we were actually looking at a site, a specific site, then suddenly the price may go up. And you don't want that to happen when you have public dollars that are involved. So what I'd like is a high-level presentation from Mr. McCoy. If some of the current assessment involves us discussing the feasibility of already publicly owned property, I'm fine with that. But separate and distinct from that, I'd like for the Government Affairs Committee to meet with the district attorney or this group, whatever group it deems appropriate, and to give us a report back, I would say within 60 days. Is that a reasonable amount of time for us to have a discussion? And I think that's I hope that's a judicious and efficient way of approaching this. Does that sound reasonable to everyone?
Sounds good to me.
Okay.
I guess, Mr. Chairman.
Yes, sir. Commissioner Jones?
Yeah, you hit the nail right on the head there. This is an excellent opportunity. This is what I was going to say with my comments, the same thing that you were saying, is to get these folks together, let them have a sit down and formulate a plan. Then we'll know exactly how much, we'll know exactly what we're dealing with, how big the building is, whatever we're dealing with, soft money, maybe there's some other monies out there. You're spot on with that. This is an excellent idea, and I want to commend all of you this morning, but certainly this is the way to go about it, getting everybody to the table so that we can roll this thing out right.
Sounds good. All right. Well, Dr. Okafor, I appreciate you being here. I also thank you to your fellow colleagues who are here. Thank you to District Attorney Edwards and Mr. Mathis and various other folks. I see that the coroner's here, and local law enforcement as well, Chief Johnson and others. So thank you all. Appreciate the presentation.
Thank you, sir.
Thank you.
Thank you.
We'll move forward. Thank you. All right. Next, EMS Director Sam Allen is present to update the Commission with the 2020 annual report. Good morning, Mr. Allen.
Good morning, Mr. Chairman, Commissioners.
Good morning. Good morning.
We'll try to be as quick as we can and get things done for you. Last year, we did not present to the board on 2019 because COVID was at a extreme high. So, as the chairman would say, we're in the middle of a marathon. We've not slowed down. We've hit the water stations. But I want to go over briefly with you how the department fared through 2020. Last year, we ran 23,068 911 calls in Dougherty County. That is a record. It was 22,900 the previous year. So we billed out 11,813 transports, and the total revenue collection was just over $3.1 million. So Medicare was 47% of our transports. Medicaid was 26%. Insurance providers was 15%, and private self-pay was 12%. It's just a brief chart here showing you our revenue collections. Even with the pandemic, things were still very good. We worked very closely with our billing service to make sure that we were meeting all the information that they needed to help get the correct payments out and the correct revenue collections. This is just an analysis of the advanced life support, the basic life support system, the calls that we run as to how they were billed out. So our billing service is really good. They do everything they can to get the maximum dollar for us. Base rates, we're still the same. We've not changed them. We have looked at various locations. Our rates are still for our demographics of this community. I think we're right in line with them. You can always go up, but you're going to increase your write-offs. So I feel that we're right on line with where we're at. Oh, let's go back.
You know what your uncollected amount is or your write-offs?
I'll have to check and see to get you that, but we're not overinflated. I know that figure. The call volume, the headquarters, EMS headquarters has two 24-hour trucks. They have a third truck that runs first 12 hours, 7A to 7P. The East Station ran 3,900 calls. South Station still runs the highest, 4,400. One change we've noticed in the last year, the West Station used to be about number 4 on the list. Now it's basically number 3 on the list. So we're seeing more people go into the physician clinics, doctor's offices on the west side. We're going to more transports over there where the doctor's offices are calling to have the patients transported to the main hospital. So west side has definitely increased.
Mr. Adler, you go back to that, please.
Yes, sir.
I think also it's an indicator for us to pay more attention to these stations, these areas where there are higher calls, whether it's poverty or crime or health statistics or food insecurities. But I think these numbers are just a sign to issues that we have to address as a community.
Yes, sir.
Thank you.
I agree with that, sir. And this is a call by territory. Headquarters is the off reddish color. You have the East Station, which is the light green. The South Station is the blue territory. The West Station is in yellow, and then the Southeast is the off brownish color. So again, we try to keep the calls as close to the call volume area. But of those 6,627 calls were run by other stations. So what that means is headquarters responded to the south, or south responded to the west, or east had to come to south, or whatever. So we're in the road. We're steady running calls. This was what was really interesting. We go by average 911 emergent response time. This is our rolling average, 5 minutes, 42 seconds. Also, there's 2 minutes and 3 seconds out the chute time. So we're still under the 8-minute national average. If you add that 2 minutes on it, you're looking about 7 minutes, 45 seconds. So the department fared very well with the pandemic going on. Peak call volume is still holding steady around 12:15 in the afternoon. We start building at about 7:10 in the morning. We peak at 12:15, but it does not slow down and end till about 1:30 a.m. So from 1:30 till 7:10, call volume is slower, but as you can see, it's stretching as the days go along. General sickness was 19% of our calls. Respiratory distress, 11%. One thing we have seen a significant increase is the falls. Our community, our citizens are getting older, so we're responding to more calls. Traffic accidents was down a little bit, so that was some good information. Standby events, because of COVID, we didn't work that many standby events. Normally we have a lot more at the Civic Center. The career fairs, we only had 3, and these were at the very first of the year. So before COVID hit, we still work some of the football games, ASU, Deerfield, Dougherty County School System. We also do standbys for Albany Police Department when they have their recruits going through their training, whether they're doing PT, they're doing taser tests, we're on standby for those. So last year, there is a shortage of paramedics and EMTs statewide. Now, we only lost 14 employees last year, which is relatively good because of the pandemic, but it is bad because they're going to other services that are paying more. Last week, I started the week out with 2 vacancies. By the end of last week, I had 7 vacancies. So these are full-time paramedics that are going to other jobs because of the pay rate situation. But the retention that we're seeing within the department is holding. Again, it's you know, you're trying to fix the plug here and there, but you get another bleed out someplace else. One thing that I do want to note is we're working very closely with Albany Technical College, with Albany State University. We've also gotten students from Georgia Southwestern and Americas. We're seeing a retention of 50% of our department, and full-time employees they started as an EMTB, they went to EMTA school, we hired them into a full-time position, they got their paramedic license. 50% of our full-time staff now are those students that we've been doing for 3 years. So we've got the right plan, we just got to be able to hold on to them once we get them to that point. Starting paramedic for paramedic is $15.52 an hour, EMTA is $14.78, and then EMTB is $13.41. And again, other services are steady going up. I talked to EMS director Saturday, and he was just in, they're in a dire situation. I said, we're in the boat with you, we understand. This is a map of the overdose situation. This is a heat map. We input this data into OD mapping, and this shows the area of overdoses that we respond to, whether they're opioid, heroin, whatever the nature is. And as you can see, the heat map is in the center part of Dougherty County. So this kind of gives you an idea of where the overdose calls that we're responding to. In December of last year, Phoebe came through with a grant to supply us with Narcan nasal spray. Up until that point, every Narcan that we gave was coming out of our budget. So as you can see, we had a substantial amount of Narcan that we were steady paying for. In December, we had 35 patients that were treated with Narcan. So on December 7th, we started using the nasal spray. And as of today, we have dispensed over 50 patients since December 7th with Narcan nasal spray. So this grant that Phoebe and Morehouse School of Medicine has really come through. The Narcan nasal spray is in the paramedics' jump bag. So this way, when they go in the house, they find the unresponsive person, they can immediately administer the Narcan without having to run back to the truck, get an IV kit, get the Narcan out of the drug box, go back in. So we're seeing a saving in lives on that, along with revenue savings, or expenses rather. As you can see, March 10, and I just happened to have some pictures when I was going back. You can see how the staff were dressed. On March the 11th, I got the phone call that morning that we had COVID patients in the community and at the hospital. We started planning for COVID on January the 24th. We started getting the supply room ready. We converted one of the rooms of headquarters, and we call it Central Supply. So it has been well received. Our partners at Department of Public Health and Phoebe, they really came through to help us and keep us afloat as we went through the pandemics. A lot of EMS services were struggling for supplies. We struggled along with them, but we had great partners, and our COVID-19 task force that Mr. Chairman oversees, it really helped us to stay afloat, so thank you, sir. This is just a broad spectrum of the staff. They have stayed positive. This is our most important asset right here. They didn't back down. They didn't run away from it. They didn't call out sick. They didn't refuse to come in. They came in, they staffed extra trucks. They did everything they could do. They wore their PPE Tyvek suits. It's just an amazing job what the staff at Dougherty County EMS did. Just a few additional pictures. Even the front office staff, they've helped out. We did N95 mask test fittings. We completed this in a matter of 3 days. Everything was just done, but it was done correctly. I do want to report that we've had 10 staff that did test positive during the virus out of 72, so that's about a 14% average. We came out in really good condition. A lot of other EMS services were hit 70 and 80% of their staff, so we followed strict CDC guidelines, the pathogen machine that we used, and our staff helped keep our numbers down. This is a graph of the chart of call volume that are actually related to COVID-19 patients. On the left of it, you can see the spike during March, April, May. As we went down, we hit a little bit increase on July, and then back again in November to December, we saw the numbers going back up. Right now, the numbers are steady on a downward trend, so we hope it stays that way. This is the pathogen machine that you approved and purchased. One of the things that we were very fortunate, our sales rep, he contacted his company and they did a white paper survey of, they got with us and Children's Healthcare out of Atlanta, and they did testing. We showed him what we were doing. They reviewed it. They said, you guys are spot on. They gave us some recommendations on how we could improve. We found that this machine was actually getting all the way into the cab of the ambulance, including the glove box. They put test strip samples in there. So they wrote a paper, they put it out, and they're distributing it to other medical facilities on information that they got from Dougherty County and their testing. So this machine has just been outstandingly amazing. December 18th, we got a phone call to mobilize the staff to start for vaccinations. We were the first group of non-Phoebe employees to take the vaccine, and right now I would say we're almost at a 50% mark inside the department. So if you take that along with the 14% that's had it, some of those are now given plasma and given help for people that still need transfusions. October, we still continue the risk management assessment of online driving. We did online training classes 4 weeks in a row, plus we do an off-site where we actually work with backing up, because that's our tightest areas where we have to go in and out of. Let me go back. Anyway, there we go. We're almost done here. So what are we working for 2021? We're currently housing a truck over at HealthWorks. We're adjusting to their schedule every day as they go along. We have a paramedic sitting there ready to take care of. We've had 3 patients that we've transported, so the numbers are very low. We're working with the Marine Base. They've got an upcoming disaster drill, I think in May. Public Health has helped secure us a mass casualty incident trailer. We've got mobile supplies in it, and we can tow it to a mass casualty event. We can treat up to 35 additional victims, so we're able to handle just about anything that gets thrown at us. Again, we're working on recruitment, and we're working to support our most important asset, our employees. So thank you from the staff and at Dougherty County EMS. We appreciate that every one of you have done to support us so that we can provide the medical care.
Thank you. Thank you very much. Any comments or
Like
questions from Mr. Allen?
I do have really one quick question.
Yes, sir.
Slide 7. Can you go to slide 7? It's the one referring to the total calls of 6,627, right there. Does that indicate that in time that we're going to need another station, since those calls in other station territories are just as high as those other ones in some point?
Yes, sir.
And how long do you kind of project?
We're looking at, the West Station is starting to reach a peak area over there, but we do have an option that we could house a second crew in that station to handle the call volume. The medical facilities that have really moved in over there, when you go and do a transport, it's roughly taking an hour. So during that hour, by having another truck over there, helps to cover that 911 call so that another truck doesn't have to come out of territory.
Okay, thanks.
Yes, sir.
Maybe we can just put it in the morgue.
Yep, you can. It's gonna be enough room.
Well, I do know, I mean, the city does have plans to build a new fire station. You know, I know fire and EMS go hand in hand, and they're 2 distinct entities, but, you know, a multi-purpose building is better than having 2 standalone buildings sometimes, especially when a lot of their calls are, you know, synergistic, so.
Mm-hmm. Let me ask a different question, and someone may even throw something at me for suggesting this. We have beaten our heads against the wall for some time trying to figure out how to tackle ISO ratings in the county. Commissioner Jones has brought it up and worked on it. He's tried everything he could. And I say this, and everybody knows my views on consolidation, okay? And I'm not saying that to raise the specter of that issue here. I've been unbashful about it. One of the frustrating areas to me has been, you got a city fire department, you have county EMS. I know that there are different schools of thought on having combined fire and EMS. I know we even looked at the issue of Grady providing us services a couple of years ago and privatizing EMS. We ultimately decided against it because we wanted to have public ownership of our own health. And ultimately, that's where I landed. And I think that was a good thing. You have a city fire department that provides countywide services to us. Then we have a county EMS that provides city and countywide services as well. Then we have bricks and mortar for EMS and bricks and mortar for fire, which this is a discussion I brought up about 2-3 years ago. It literally drives me crazy that we do this. It's the same as when you go down to Riverfront Park and you see that the grass is cut at Ray Charles Park on a different day from Riverfront Park, which literally drives me insane because the city has a guy that cuts their grass, and the county has a guy that cuts their grass, and it's just an example of how we're remarkably inefficient. Is there a way, I'm curious what would happen if the county with our EMS, if we actually cross-trained some EMS staff as firefighters and put them in some of our, and they're there and capable of being picked up or also working along with, AFD. Is there a way to tackle that ISO issue? I don't know the answer to that. Can you speak to that, Mr. Allen? I know that sounds like a crazy idea, but is that a way that we could actually tackle that issue?
Mr. Chairman, there's many ways to go at it. The one thing that works against us is our call volume. The call volume. In order for your ISO, you need those booths to be ready for fire calls. But when you've got trucks that are just steady moving and rolling, that puts us in a little different situation. So there's just a whole lot of things you'd have to look at, sir.
Sure, and I mean, there are ways to do it. You can make people like joint employees and pay them more. One of the things I hear from EMS is this, Dougherty County is sort of like the Fulton County sort of Grady of Southwest Georgia. Like you get a lot of great experience. It's a small, big town. And then like you go, some of these EMTs go to Worth County, Lee County, et cetera. They sit around and, they sit in the station most of the day. And I'm not saying that like those folks work hard. They like to work hard, but it's not the same call volume at all. But we do experience regionally a lot of turnover and people bouncing from place to place to place. Is that what you're seeing as well?
Yes, sir. People are going where they can make more money, and that's just the bottom line. They're looking at where can I get paid a higher rate. But they're also, they look at our call volume and how busy we are. We average about 65 calls a day, and then your truck may run 18 to 20 calls a day, but if you go to one of the small surrounding counties, you might run 1 or 2 a day. So, they're sitting there, and then those would be more available for your fire standby or fire support and that. But where they're steady running 18 to 20 calls, they're hopping from call to call to call.
It just seems to me that the state legislature is going to have to get involved at some point and say, we're going to provide a financial incentive to regionalizing EMS services so that, you have a pool of folks that get paid more and actually, you service Lee County, Dougherty County, Terrell County, what have you, and you actually get more bang for your buck. And I think the same would honestly apply in regions such as this with fire departments as well, especially for non-police services where that just seems to make sense.
So,
That just makes more sense to me, I don't know.
you know, from a business model perspective, EMS does what EMS does, but yet there are tons and tons of medical transport companies operating under, you know, in the county for lots of different reasons. And I know, you know, Phoebe, for instance, they you know, farm out their transport services to Grady. You know, I'd love to maybe revisit a conversation around, you know, perhaps, you know, could the county scale up and get some non-emergent transport, provide patient transport services within Dougherty County that, you know, could help drive revenue, as long as that business model is, you know, a net positive investment for the taxpayers. You know, would Phoebe support something like that if, instead of putting all their eggs in one basket? You know, that would also give us the opportunity to look outside of Dougherty County on how we could maybe serve some transport needs, or non-emergent transport, or even non-emergent call support for other counties around Dougherty County that frankly don't have the financial underpinnings that we have. You know, everybody's running lean, but when you only have 1 or 2 ambulances for an entire county, that can be pretty bad. You know, if you need it, if they're running transport or other people are running transport and they frankly can't afford to get into that. So I just wonder if there's a secondary service opportunity we can. I mean, obviously we're running at high RPMs right now, so it's either put in more EMTs and do more of the same, but don't overspend so we can stay busy enough to stay, you know, cash flow positive on this. But at the same time, there's a lot of people here that are, you know, taking revenue opportunities away from us when it comes to skilled medical transport.
Yes, sir. That is definitely an option, and, you know, with the right salary range, you can recruit people. So there is a lot of transport out there. There's a lot of revenue to be generated from that. So, yes, sir, that is definitely an avenue, sir.
Let me ask you one question. Do you have enough capacity now to handle that Lee County area up there?
To handle the capacity for what, sir?
For the Lee County, I'm talking about that southern portion of Lee County where they have such drive times to get to. And we've got stations that are fairly close by. Do you have the capacity to be able to do that now?
You know, sir, on some days I would say yes, sir, and some days I would say we might be a little limited on that, in that aspect. And again, it just depends on the call volume as to where we're going. But if we have the support staffing, then you have different options that you can work from.
Great. I'm just looking at it as a businessman's perspective. So.
I understand. All right, thank you very much, Mr. Allen.
Thank you, Mr. Chairman.
All right. Mr. Forgy, Director of Planning and Development Services, present to update the Commission with the 2020 Albany Dougherty Land Bank Annual Report.
Good morning, Mr. Chairman, Commissioners. I have a very brief presentation for you all to go over some of the achievements over last year for the land bank. First of all, I'd like to thank the Board of Directors. Thelma Johnson is the chair. Larry Thomas is the newly elected vice chair. Jamie Cobb, Secretary Treasurer. Debbie Sutton, Patrick Bush, Eric Williams, and Jim Pace are the other board members. I'm the executive director of the land bank, in addition to being the director of planning and development for the city and county. I am hired by contract with the land bank for a $0 salary. And Angel Gray is also the programs manager for the land bank. So just to back up a little bit what a land bank is for y'all, just as a refresher, I learned something pretty much every day about what a land bank does and what a land bank can do. So some of this will be a refresher to you, some of this may be new. The land bank was created in, 2017. It was through a mutual agreement of the city and the county, and the Dougherty County School Board is also a participant in the agreement that created the land bank. The primary purpose of land banks across the state is to return delinquent properties tax delinquent properties to productive use. And we do this primarily through in-rem or judicial tax sales. This is different from the non-judicial tax sale, which occurs every August with the tax department. But what this does is it eliminates blight in the community. It increases the amount of safe, decent housing opportunities. It increases the tax base and stabilizes neighborhoods. And it also builds wealth through sweat equity, because we make properties available that are generally pretty inexpensive. And they're properties that people who are first-time home buyers or first-time developers, people who otherwise wouldn't be able to enter this realm, they're able to because of the low prices that we can pass property on, and it helps them build up their wealth, and then it builds up the community's wealth. So over the last year, a few things that we've done. We have created, but not begun, a reforestation program. We are going to be buying a number of trees and allowing them to mature over a few years before we actually install them. This way we can put in bigger trees than we might have otherwise for a lower cost. We're going to look at areas that were affected by the tornadoes or areas that we might be working in for housing. We created a scholarship in honor of Robert Carter, Code Director, who passed away last year, for new attendees to attend the Georgia Association of Code Enforcement Conference. The last conference, I think it was last month, we had 5 scholarships that we gave away. We've also created for training for land banks and code enforcement that has been given at the GACE conference. Angel Gray is newly elected president of GACE, and she provides training for code enforcement officers about what land banks can do. We have been trying to do a retreat. We scheduled one last year for, I think it was for March, which we had to cancel, and we rescheduled for October, and we had to cancel. So we're going to do it sometime, but there's a big interest in land banks across the state, and a lot of the resources down here are far and few between, and we have become known as a good source of information. So we're going to host a land bank training for the other land banks or people who are interested in land banks around South Georgia. So over the last year, we have had over 110 applications for property. We've conducted 79 tax sales. Of those, 63 were properties within they're vacant properties within a subdivision. 6 were vacant lots, individual vacant lots, and 10 were properties with structures that required rehabilitation. We had 19 closings since June of 2020. 2 were for first-time home buyers. 5 became or will become affordable rental housing. 1 is a rehab within the historic district. 3 are commercial property rehabs, 4 vacant lots. 2 lots were sold to adjacent owners. This is a program called the Side Lot Program. There are a number of vacant lots next to people who are responsible and who own their property, own and occupy their property. We're trying to sell those vacant lots, or basically we end up losing money on a lot of this, but to get that property into a responsible person's hands. That way they take care of it. The city and county don't have to take care of it anymore. It goes on the tax rolls, and it's no longer our responsibility to mow. And also 2 properties were sold for future home sites. And since June of 2020, we've returned over $120,000 in tax revenue to the city and county and school board. Now this was done because sometimes when we go to get a property, it goes through the process, the judicial tax sale process. Sometimes people will redeem the property. They will pay the taxes on it before we can then bid on it and acquire it. So sometimes the taxes get paid that way. Other times, people will bid competitively against us, and when they do that, they have to pay the back taxes. So since June of 2020, over $120,000 has been returned in taxes because of our actions. That's beyond putting property in people's hands that they can reoccupy and redevelop. So that's my very brief report. If you all have any questions, I'm available for answers.
Any comments or questions?
I have one comment. I think it's a great idea that you made the scholarship and named it after Mr. Robert Carter. That was phenomenal. Thank you for your leadership in that.
Very good. Thank you. All right, thank you very much, Mr. Forey.
You're welcome.
Let's move on to Georgia Collier Bowling, Director of Disaster Recovery and Grant Programs, present to provide an update on disaster grants and programs.
Yes,
Good
sir,
morning.
Chairman, good morning.
Good morning.
Well, first off, we can see that we have listed, everybody has a handout for the overview.
Ms. Bowling, I'm having a hard time hearing you. Can you hear me?
Yes, sir. Can you
Okay.
hear me better?
Say that one more time, please.
Can you hear me better now?
Yes, ma'am. If we could turn the
Okay.
volume up just a little bit, that would be great.
Yeah, I did. I don't know. I did. Hold on a second. Let me try it again.
All right. Go ahead, Ms. Bowling.
Okay. So the first thing I asked was to make sure everybody had a copy of the handout. And so we're actually going through the list of grants that we currently have and the future grants that we'll be entering into. So the first grant that's listed is for the CDBG-DR Housing Rehab and Reconstruction, which is for the HRRP program. And that's our program that covers the 2017 storms and tornadoes and Hurricane Irma for residents who received damage to their homes through either one of those storms. And so as of today, we have a sub-recipient agreement signed for $300,000. But this is the initial grant that was provided in the sub-recipient agreement. Of course, the grant will increase because it's based off of the number of homes that are actually made eligible and repaired in the program. As of now, based off of the number of homes that we have, I have an estimated cost set at around $1 billion. And that's from the Department of Community Affairs, the state of Georgia. So next we have the CDBG DR Unmet Needs, the Voluntary Housing Acquisition Program. And we are in the process of waiting on the award letter. We have 2 more documents to send in, and then we will be receiving an award letter from DCA. The next item, ma'am. So the next item we have is CDBG Mix Planning 2017. We submitted an application for funding, and the budget was for $307,215. The next one is the CDBG Mix Acquisition program. We submitted a application for the CDBG Mix Acquisition 2017 for the $700,094,821.17. Next, we have CDBG-DR for Michael, and that's to be determined. The state did contact us a couple of weeks ago and said they are in the process, and soon we should be receiving an award for Hurricane Michael. For CDBG Mix 2018, it's to be determined as well. 2 weeks ago, I submitted a survey in regards to the 3 types of interest we would have for funding under the CDBG Mix for 2018. Once the state looks over those, reviews those surveys that sent in, that's what they use to determine what type of program they will offer, and then we'll come back and submit a formal application.
Let me, Ms. Bowling, I'm going to stop you for 1 second and just ask a few questions. So, I see that the CDBG-DR Housing Rehab and Reconstruction Program, we've requested $1 million, and we've been granted $300,000. And as I understand it, with respect to the 2017 disasters, $64.9 million was awarded to the state for the 2017 disasters, and Dougherty County, let's say zip code 31705, is entitled to a large portion of those funds. What does the housing rehab and reconstruction program look like? Like, what do those dollars do, and when will they actually be deployed?
Yes, sir. So, and let me go back to the 64, to the total amount of funding that DCA got. And that'll help explain a little better, and then I'll direct specifically to the HRP. So the disaster funding for 2017 that DCA got, which is for the two storms, straight line wind and tornado, and then Hurricane Irma. So that's divided out into different types of programs. Okay, so one of those programs that DCA has is funding for housing, for rehab and reconstruction, and that's what our first item is on the sheet, on the handout. And so the initial grant amount that they set was for $300,000. So what DCA did, that's a little different than most normal places, is that instead of allocating funding out to each individual municipality that qualifies for funding, they just issued a small grant amount under a subrecipient agreement, which basically was set to cover the activity delivery costs, so the cost of salaries, things needed to operate the grant. And so they set it up to where it's competitive. In other words, the Dougherty County, the City of Brunswick, and Cleveland is basically competing for this money under disaster CDBG for 2017, the housing allocated portion. And so that's why we don't have a definite award amount other than the $300,000. And so, typically in all the places, I've encountered in my 20 years of doing it, grant agreements are issued and the money is allocated, for a set amount. So, if you got 3 agencies, depending on, how much damage in the most impacted area, you might set up, say, okay, we're going to give Dougherty County $3 million. We're going to give Brunswick, $2 million, and so on. But they didn't do it that way. They made it as a first come, first served.
I don't know. That strikes me as bizarre, because.
Yeah, I agree.
So, I don't want to sideline the presentation, but Mr. McCoy, I'd like to get a private briefing on this component, because I've spent a lot of time and effort working on this issue, and last I checked, today is March 29th of 2021, and we're 4 years from this disaster. And I still don't, I don't understand, I don't understand what the $300,000 is actually going to do.
Yeah, so that was,
So, Chairman?
Yes, ma'am.
So the $300,000 as right there as of now, that covers costs of salaries, things to operate the grant, salaries, Collier.
Yeah, it sounds like a bunch of bureaucratic red tape.
so it's,
that doesn't put a brick down, a foundation down, or a nail in a board.
Yeah.
That's the frustrating component to me.
So the 300,000 is seed money.
Okay.
So we couldn't move forward with implementation of the rehabilitation part of the program until we went through a lengthy process to hire a subcontractor. And so we went through that process, we hired a subcontractor. Subsequently, we decided to bring it in-house. So
Okay.
we are adding additional staff. We're gonna have a complete department dedicated to recovery and grants management.
Which will make us more competitive?
Well, we are very competitive because we have the most expertise in
I got you.
terms
Okay.
of administration.
I
So-
do want to get a briefing
Yes.
next Monday, privately, and I don't want to disturb Ms. Bowling's presentation. There's a lot, I've just spent a lot of time and effort on this issue, and I want to make sure that I understand everything. And I got a very positive phone call from the DCA director the other day, and I don't want any of my comments to be suggestive that anything's wrong. I just,
Yes, sir. And I would like to add
Yeah.
that the $64.9 million will be divided at least into 3 different categories.
Right.
Housing will get some of that money, infrastructure, as well as economic development. So the first program that they're funding is housing.
I got you. Okay. All right, go ahead, Ms. Bowling. I didn't mean to sidetrack you. I needed to ask that
That's
question.
okay. No, we're fine. So back to my point was that there are, in that 64 million, there's multiple components. And so one of our this housing program is one of those components. The unmet needs, which is the voluntary housing acquisition, that's also another component under that 64 million. And then you have the CBD event planning 2017, that's also another component under that 64 million. Okay. So, and just to give you back to your question for background in terms of that, the HRP program and the housing, it's a housing program, again, that's designed to assist applicants with repairs to their homes. So that's what that particular program does. So we have that program ongoing, and we're doing quite well in it. So I'm very happy with where we're at. And let's see, where did we stand at? HMTP acquisition program. And so we submitted an application to Fema, to FEMA, and now it's at FEMA, waiting for approval for the $4.9 million. And this will be a acquisition program to acquire homes in certain areas, and those properties have been selected, and it's 30 properties that will be acquired and bought out. The owners will be bought out for the property. The next one is HMPG, which is another acquisition component, and it has 4 properties, and that's under Hurricane Michael. So the 30 properties are under 4297, which was the 2017 storm, and the 4 properties are under Hurricane Michael. And this is with FEMA for the HMGP program. And then we have our HMGP program for the Sirens program for the $750,000. And that's going to be to purchase 21 sirens to be placed in the county. And our next one is FEMA COVID-19. And so I submitted applications. The application currently standing is, the request is at $250,000. This amount could fluctuate. It depends on all the actual expenditures once we get through. It's basically an estimate. I also want to reference and mention that the FEMA COVID-19 funding is ongoing. So it just didn't stop in 2020. It's a continuous program until the federal administration decides that, it will not, that it will stop. But until then, it's ongoing. So we will continue to get reimbursed ongoing for FEMA COVID-19 reimbursement. The next program with FEMA is the FEMA Brics program. And it's also going to involve acquisition of some properties as well. Very similar to the HMGP acquisition program. And so basically FEMA Brics is a new program that has come about where it picks up projects that were not able to be funded by HMGP. When HMGP funding ran out, those applicants were able to get additional funding under the FEMA Brics program. And of course, we made application for $451,982. And so we have two components under that program for Brics. We have the acquisition, which was for the first one, and the second one will be for safe rooms to be out in the county. And then the total cost of that for the application submitted was $548,113. And then underneath, where we have outstanding grant funds, these are just our outstanding funds that we're waiting on for the final reimbursements to come in under Fema, under the public assistance part of our program for 4297, which is the 2017 storm, and 4338, which is Irma, and for 4400, which is Michael, for the $59,293.27. And then we have a separate category for funding attached to our PA, is for the administrative costs, which is $214,008.29. So in total, we have estimated $707,039.07 of outstanding FEMA funds. We expect to be coming in within the next 30 to 60 days max.
So Chairman, are you finished, Ms. Bowling?
Yes, yes.
Okay. Yeah, so that concludes the presentation. I do want to make you all aware that this has sort of been a snowball effect. Last week, you were notified that I was contacted to participate in the National Public Risk Management Association's conference. And so it was a sort of surprise to me when I was contacted, and then when I saw the spreadsheet, I realized why many communities are not in the situation that we're in, where we experience multiple and repetitive natural disasters.
Right.
So therefore, we're now kind of the big leagues, if you will.
Right.
We're gonna have a department dealing with this. I was trying my best, along with other departments, to manage all of this. Ms. Bowling came on board to strictly deal with HHRP. Because she's a subject matter expert, she was able to take on all of these additional duties without complaint. She's very gracious, and we're very, very fortunate to have her. As we mentioned, the HRRP program is a competitive process. And if we did not have this expertise, we wouldn't be in the forefront of getting to the available funding first. And we believe that we're going to be first, and we're going to be able to help our citizens first in the state.
Gotcha.
With that program. And so Dougherty County is in good shape. And
Good to know.
Most communities are not dealing with this number of disasters and federal programs.
Or the planning. I mean, we went through an expedited planning process in order for us to be able to make the ask for the dollars. So
yes,
that was on a compressed time frame.
Yes, sir. Dougherty County has demonstrated great leadership in getting the funding that the state, on behalf of the state, that they had never received before. And this program that we're currently implementing, we've never done this before. So it's not like you can go benchmark Atlanta or somebody else. People are benchmarking us because we're making it up.
I understand.
And we're getting this done.
Very good.
So I want to make you aware of that.
All right. Excellent. Thank you. Thank you, Ms. Bowling. We're going to move on to purchases at this time.
Yes, sir. Thank you.
Thank you.
Excuse me, Chairman.
Yes, ma'am. Oh, I'm sorry. Thank you for reminding me. Mr. Murray, Paul Murray is here to speak on community homes. I'm sorry, Mr. Murray, I did not mean to skip you. Thank you. Good morning.
Good morning. It's been a while since I've seen you. Hurricane, tornadoes.
That's right.
My name is Paul Murray with AY. Appreciate you all allowing me to speak before the commission. I've been a Dougherty County resident for almost 40 years. I moved down here from Raleigh, North Carolina. And I picked the Radium Springs area, 31705, we just discussed, to live. At that time, in the mid-'80s, it was a community of mostly retired military, of which I'm former survivor of 3 wars in the military and a veteran. The unfortunate thing about our area is that being the retiree community, a lot of the people are expiring, and the home situation is constantly changing. The flood of '94 did not help. The tornado of 2017 again, and then Hurricane Irma and Hurricane Michael, and which I worked with hurricane relief and tornado relief for many months in the area. How this came to a head is on March 10th, I was working in my yard, and the Dougherty County Police Department was next door again for the second time within a week. And I saw a lot of the people that had evacuated from that home, which had been turned into a community group home. And I asked them what was going on every week with the police being there. And one of the ladies looked at me and says, "This is a behavioral home business." I said, "Oh, okay. It's a behavioral home business." I thought we couldn't find out any information when the property was bought because the people next door, his wife had died, and then they put it up for sale. And the only thing I could find out was bought by some lawyers down in Valdosta, and that's all we could find out. We thought it might have been maybe an assisted living with a few people living in there with a few nurses in there. Well, as it turned out, I don't have a PowerPoint presentation, but I do have pictures. As the property was renovated and sprinkler systems and fire equipment and everything was finally in there, they moved in. And it started turning into be almost like a car dealership. I've got pictures of 9 vehicles in front of that particular house.
Can I see that? Can I see? You mind? Yes, sir. Thank you. What's the address?
410 Poinciana.
410 Poinciana?
Mm-hmm.
I'm just making a few notes. That area is not zoned for commercial.
Well, I guess just give you a little brief background. I had asked Mr. Paul, he lives around the corner. It's owned by Rest Care. And it was, I guess, I'm glad Mr. Paul was here, Mr. Forget, as well as the chief, because that was when we did that ordinance on so many houses. Well, what is it? We can allow, 4 people, Mr. Forget? When we did the ordinance a couple of months ago on the group homes in the neighborhood.
Prohibiting them.
Well, you reduce it from 6 to 4.
Mm-hmm.
So if you want Mr. Forget to kind of.
You are correct. I have a chart where it says it's been reduced to 4 non-related persons living in the home.
Right.
It's owned by Midtown, Georgia, LLC. As I further investigated, I found a half a mile down the road on Cherry Laurel that is also owned by Midtown. And in the beginning, they had the same parking problem. And then across on Holly Drive, at 400 Holly Drive, that is owned by another, a retarded association home.
I think it's S-5.
So we've got 3 of them within a half a mile, within walking distance of me. They have, the problem being with, I have two areas of conflict here. Behavior home, who is in the home, and if they had to be evacuated because of problems. I just got a police report just a half an hour before I got here through the city attorney's office of all the calls from inhumane treatment to disorderly conduct and demented person. So if they had to evacuate that home because of those problems, and then I was talking to my neighbor across the street, she found one of the ladies walking down the street, and 2 of the ladies that are supposed to be assisting this home was running after him. She just sat down in the middle of the street and refused to move. I checked with the neighbors at Cherry Laurel. They have the same problem, people escaping from that house, checking their mailboxes and going across the street. That's on camera. And I say I have the police report on that. It is concerning to me if I'm out in the yard, if my wife's out working in the yard, who is in these homes. But the biggest problem, as I told Victor, is They don't care, the people that work there. They are tearing up the front yard.
I'm sorry, they don't care about what now?
They don't care about
Parking the
the
car.
property.
Oh,
They're tearing up the front yard,
yes, sir.
and since they can't park in the front yard, they're starting to park in the front of my yard. And
Mr. Chairman,
Yes, sir.
you know, if you fast forward, if you roll this camera back in the recording, I told you all that when Mr. Forget brought that for us, and I said to you all at that time, group homes need to be like car lots, mobile home parks. They need to be in a special location. And here we are, less than 6 months after we approved this thing, and all these folks are coming forward with these problems. This is a problem that we created for the citizens of this community, and we need to fix it. I mean, because I knew it was going to happen. And it's not fair to them. We need to revisit this one.
I thought our
certainly do. I don't know what the legalities are that we may.
I thought our goal was
the ones that are already there.
to keep group homes out of neighborhoods. That was the whole purpose, wasn't it? Or to make it harder.
Well, it was to, I guess you really would like to go back to Mr. Ford to give, you know, his, the direction of the ordinance. And, I agree with Commissioner, Jones, but I guess you need to really, would you come forward, Mr. Ford? And then also we did have the, in dealing with the references of the police calls, Chief Johnson had went back and pulled the records of the police, you know, the reason they did come to the house.
I still don't understand, and perhaps it's my own ignorance.
Right.
I still don't understand how you can operate a business in a residence if it's just residentially zoned, unless there's. Can you talk to this, Mr. Forey? I'm missing something.
Okay, there's a number of different things. First of all, I'll address that. You know, in general, zoning separates uses, commercial, residential, industrial. But there are some uses, some commercial uses that are allowed in residential areas. You can get a business license and have a home-based business. You can sell, you know, you can make widgets in your house and sell them on the internet. It's a business, and you can get a business license for it. Some things you can do, including some types of group homes, living arrangements like this. And up till recently, when you all changed your ordinance, the county allowed by right in residential zones to have up to 6 people in a personal care home environment like this. But there was no additional regulation on it beyond that. The reason that we
made it more restrictive.
Made it more restrictive, but also put other things in it to monitor, to make sure that these are licensed by whoever licensed them, usually it's a state agency, to make sure that they have legitimate license, they don't just call themselves a group home.
So let me ask it this way. To address Commissioner Jones's question or comment, this home could have been here anyways. We didn't do anything that created like this new marketplace. In fact, we restricted the marketplace. Is that correct?
That is correct.
Okay.
It probably pre-existed.
It probably pre-existed.
If it pre-existed, then it probably is allowed to be grandfathered in, provided everything was done about it. When it was done, it was legal at the time.
Got it.
If it was done since then, it could be forced out.
Okay. Okay. So that is where, all right, keep going, Mr. Ford. Sorry.
Okay. So the new ordinance allows up to 4 by right. Any more than 4, they have to get special approval from.
But they got 9 cars in their yard.
Well, I have 7 kids and I have a lot of cars in my yard. Well, not in my yard, but I do have a lot of cars in front of my house.
So I'm just saying it's pretty good. It's pretty good evidence there might be more than 4 people.
It is, but we don't have any regulations on how many cars people can have. It is a good indicator.
Excuse me, Mr. Paul, I think that's the staff, because what Mr. Paul is, also the other Mr. Paul is referring to, they have the staff members, they got, I think you have 4 patients with, I don't know, 4 constituent, well, people living in the house, and you have the staff members. Then now what they've done is put a yard sign saying we hiring, And then another thing that Mr. Paul had referred to, you know, they were doing the training, so that probably was the day, I guess, they were doing the training for, you know, the patients. So again, he lives on one side, so the house is definitely in the middle of the neighborhood, you know.
It's frustrating.
So now it's like, the reason I invited him, I told him twice, I don't have the answer by myself, so I wanted you guys.
I don't either, but I'm very sensitive to it, and
yeah,
the folks in that area have had a lot to digest between the 94, 98 floods, 2017, 2018, and then folks were good enough to be rebuilt, and then I understand exactly where Mr. Murray's coming from.
There are foreclosures going on in the area.
This is Gloria.
Yes, ma'am.
Is there any circumstance under which it becomes a police matter that could lead to more or the potential for closing the facility?
I don't think it's a police matter. I could be wrong on that.
If you have a house in a community where there's constant endangerment, isn't there a possibility to actually insist that be rectified?
I think you raise a good point, Commissioner Gaines, and I want to make sure we hear Mr. Murray out completely about all of the complaints. It does seem to me to be, I don't know if they're violating a code or not, but it does seem to me to be very aggravating that you would see this activity which doesn't add value to the neighborhood.
No,
it
matter of
doesn't.
fact, I refinanced my home and my property values were $30,000 less than fair market value on my tax records. 410 was purchased in 2018, and they started after development like late 2019, 2020, by the time they fitted all the codes. And in conducting investigation with Victor, I believe Victor says they have a state license, but they don't have a county license. Is that what you said?
That's what Mr. Paul had forwarded to me. They have a state license, but you weren't sure whether they have a local business license.
Right.
Yeah, I mean, if it constitutes a nuisance, do we have any authority to deal with that nuisance?
I think there's two separate issues. There's one is whether or not they're violating the existing codes. I don't know whether or not that is happening or not. And there's secondarily whether or not they constitute a private nuisance for which Mr. Murray or perhaps the homeowners association would want to seek litigation. I can't speak to that. Well, what I can speak to is whether or not, or maybe Mr. Forey can speak to, is whether or not we have an effective tool to look at with respect to this, because I'm very sympathetic to Mr. Murray. I mean, can we at least send code enforcement out there to check and make sure they're following all the rules?
Yes, I would suggest if code enforcement is not aware of this, that we make them aware of this and then the other addresses that were mentioned, and they look at if they have a business license or not, if they were established according to the ordinances that were on the books when they were established, and if they were not, then we can make sure that they meet current standards.
Can we get a presentation from code enforcement? And I would like to invite Mr. Murray to be at the meeting. I'd like to get a presentation from code enforcement with a comprehensive picture of the number of group homes that are in the unincorporated county, where they are located, and you know, what is the assessment of whether or not they're doing the right thing or not. Can we do that in the next 30 days? Would that be reasonable?
I can't speak for code enforcement, not being over them anymore, but I think that would be reasonable.
Okay. Let's, Mr. McCoy, can you initiate that request for us? I'd like to get some answers to that. Mr. Murray, I don't know the answer to your concerns, but what I can do is try and figure out a way there.
I did pull the code enforcement, section 13107, dated 2013. I believe the county and the city does cooperate with the two. And they're talking about community residence requirements that could impact the residential character of the neighborhoods, which is that. And business registration of existing community residents. They have to have an occupational, pardon? Oh, that is? Okay, well, I could not find anything in the county, but from what I've found out from this, they have to have a sprinkler system in. They do have one at 410. They do not have one at Cherry Laurel. They have, technically, every 10th house in the neighborhood could be a community group home because it's a 1,000-foot restriction, or every 5th house behind me. They're supposed to post the fire, tax, and state licenses on their door. It's not there. And other things that I looked at through here. And you're talking about operating a business out of the home. In 1993, 94, before the flood, my wife ran a store right across from the DNR headquarters, but she was visited by the sheriff and knocked on the door and said, "How come you're working out of the home as a business?" And she said, "No, sir." I said, "I have a storefront." Well, she was getting the mail there because the landlord was picking up everybody's mail. And then I had a federal firearms license, and it was up for renewal in 1993, right after the Brady bill. And I was denied by the Bureau of Alcohol, Tobacco, and Firearms for operating out of the home because it was not licensed to operate a business out of the home. Okay. So that's kind of what Mr. Cohilas is talking about. But, and they discuss in here with the city about the behavioral issues. That's my concern. If it's a behavioral home there and they're escaping, I have concern for my family's welfare.
When we say behavioral home, do we mean people that have disorders, like mental disorders?
Yeah, it's fire.
Okay.
It could be anything. It could be from drug rehab. I remember last year they were petitioning a church that was being renovated to a drug rehabilitation center. They were picketing in front of Fred's there, and I signed the petition, and I don't think that ever went through because the residency there, they got up in arms and everything about having this community mental home right next door in their community. But these are being, Mr. Edwards didn't know these homes were being bought out and then being repurposed to that. We couldn't find out information until they were there. There was no, nothing came up before
I didn't know that either. I didn't know it was a big issue. In
then
fact,
I started finding out here, there's one over here, there's one over here. I know with 3 in my area that I can walk to.
It's interesting because I brought the issue of the group homes up after I had another citizen come and complain to me about it. So then we tapped Mr. Forgy. And I thought we did a pretty good job of making it even more restrictive, but apparently, I guess there's just something going on in the marketplace where these, they're probably getting some sort of federal funding or whatnot. I don't know the answer to that, but I certainly empathize and sympathize with Mr. Murray and the neighbors because that is.
It's affecting me, my next door neighbor across the street. I believe you said something about a lady across the street got her mailbox knocked over. It's still laying in the road. It doesn't affect you until it's there, but it can affect you because there are other people that may be your neighbor that may sell the home or foreclose or thing. Also, bam, there it is.
I have a question. Mr. Forgy, does the city have a moratorium now on group homes?
No, sir.
Okay. Was it one at one time?
Yes, while they were studying that ordinance, or to put an ordinance in place, they did have a moratorium.
Are we allowed to put a moratorium and unincorporate it while we study the issue?
Yes, but the ordinance that you adopted a couple months ago, I think the ordinance covers it real well going forward. The issue is what's happened before the ordinance.
Grandfathered in?
All right, so let's do this.
A question.
Yes, ma'am.
Does it matter, does the ordinance address the kind of group home it is? Because you have a group home that deals with ex-felons, a group home that deals with folks with addiction, a group home that deals with folks with mental illness. I does the ordinance at all, when you say group home, does that include any and everybody who lives in a group, or does it specify the kind of group home it is?
That's an excellent question, Commissioner. It does specify a variety of different types. We call them community residences because that's a blanket term for non-traditional housing. There are a variety of different types. There's for people with disabilities. There are boarding houses. Fraternity houses would fall into this. There are people with developmental disorders, people with drug addiction or recovering drug addiction, people who are released from prison or other kinds of restrictive living, and those are treated differently depending on the type of use. The group home is for people with developmental or physical disabilities, and that's a generic term for people, a home for people like that.
Well, what kind of home is this? The three Mr. Murray's talking about.
It sounds like for people with developmental disabilities.
Okay. All right, so.
You see, this is, go ahead, Mr. Boyd. See, this is what happens to our residents in our neighborhoods. We got all these sophisticated names. We got the community residents, and people don't really pay attention to these things. We need to call these things exactly what they are. You got a babysitter, they calling her a nanny. You know, we need to do better. And we're restricting stuff on paper. I mean, that's where it is. It's restricted on paper because it's not happening in the communities where these homes and where these neighborhoods are. We're dealing with not a group home now in District 6. We're dealing with a business that the ordinance said one thing, and after they operated for 3 or 4 years, they got out of character, started doing what they want to. We got to police these things better, folks. We have to do this for our citizens.
Yes.
It rubs a sore on my back to have to stand here and listen to this gentleman go through this hardship in a place where he's trying to call home. It's just unfair.
Yes, sir. All right, Mr. Murray, was there anything else you wanted to present?
I just wanted to point out from all my research that the community group home is one of the top 5 profitable industries in the United States. And I have
one of the top 5 what?
Profitable. Commercial profit-making, you know, that's why they're going in there. I do have a copy of the police report here, too.
Yes, sir, please. We'll make it a part of the record, and what I'd like to do is, Mr. Forgy, if you would please make a connection between Mr. Murray and code enforcement. I'd like for those folks to go and check these homes, make sure they're actually complying. I would like for us, Mr. McCoy and Mr. Forgy, for y'all to please arrange for us to have a presentation from code enforcement the next 30 to 60 days on, I want a comprehensive assessment of the number of group homes that we have in our community. I'm sure that we're not the only community that is experiencing this. I know that we were trying to be proactive by making our restrictions more restrictive. Obviously, something's going on in the marketplace around the country where these things are becoming profitable, so we're not unique, but we can be unique in how we approach it. So with that being said, Mr. Murray, I thank you very much. Very good presentation. I appreciate all your hard work. I don't know if we can solve this problem or not, but we're going to figure it out.
I just want things to quiet down. When I was trying to find the ordinance, that's the only thing I found, and I assume that the city and the Dougherty did the same thing, but Mr. Fogarty said that the county has their own ordinance, but I couldn't find it. I got this off the internet.
And let me ask this. Instead of there just being a regulatory or policy solution, is there a way that we can just connect, like the Neighborhood Watch Association, like have somebody go over there and say, look, guys, can you stop parking your cars this way? And I mean, this is really driving us nuts. And we'd like to have a cup of coffee with you. Can we get y'all to do this? Because this is really harming the value and we're going to try to be good neighbors for you guys too. Is there a way we could do that?
The business owner?
Mm-hmm.
Probably the direct owner, well, he's probably subcontracting to that, and then the biggest thing that's upsetting with me is they're using the house as a training facility. They have that sign that I showed you outside in the front, advertising it as a business. And over on Cherry Laurel, there's a sign also in front there.
I wonder if
And
that's.
it's
if that's
disturbing
legal or
that
not.
all that activity
Yeah,
going
it's
in the
legal.
backyard, going in the front yard. Things are
Yeah,
going on
to me, the issue
all
really
through the
is,
night.
what are they really doing there?
3 or 4
And-
o'clock in the morning, they're doing shift work. They have, their boyfriends are doing pulling wheelies in front of the house, leaving tracks in front of the house. It's not a good environment anymore. That's what's disturbing.
Yeah.
And if they have a behavioral issue and you're seeing walking down the street, what are they going to do to the other people in the neighborhood? And I thought it was like, I don't have a problem with assisted living. Their assisted living probably as old as I am. A couple of nurses sitting in the house, very quiet. That's what I expected, but it didn't turn out to be that way.
I think we need to do whether or not any laws are being, do an assessment of whether or not any laws are being violated.
I agree. Mr. Forgy, would you please hop on this for us and give us a progress report? And Mr. Murray, thank you very much.
Okay, thank you for your
Thank
time.
you, my
Thank you.
commissioners.
And I guess, Mr.
Thank you.
Chairman, I don't know if Chief Johnson was here, because I had asked him to pull the police report on, I guess, how many police cars were like dispatched there. If you want to add real quick.
police report there.
Yeah.
but
Chief,
with
could we just have somebody go and talk to them, tell them to be good neighbors too? I mean, like,
Usually the calls that we receive,
Yeah.
call, but when we get there, call is usually real sign or like group home disorderly conduct, that's kind of give a person mental illness. EMS is then called.
yeah.
They generate-
It would be really nice if someone in the green,
It's the DCPD,
say again?
Dougherty County Police Department.
Well, say that one more time, Mr. Murray.
That's the Dougherty County Police Department calls.
Mm-hmm. Yes, sir.
I'm right on the Dougherty County line. Right, I'm saying we received the call. But
Okay.
Once we get there, the nature of the call changes. We might receive that as disorderly conduct. Once we get there, we find the person might be demented, schizophrenic,
Sure.
or whatever.
What I'm talking about is having a guy in a green uniform go knock on the door and say, why don't y'all be good neighbors?
Nurses, yeah.
Just some community policing, if that makes sense.
Yes, sir. Yes,
Yeah,
sir.
I think that may not be an official solution, may be an unofficial solution, so.
Now, this particular company actually has a business name. Mr. Forgy, Mr. Forgy has all the information to make those contacts through code or the chief. So we just haven't mentioned the name of the particular company.
People tend to behave better when folks are looking at them, they know they're being looked at, so. All right, thank you very much, Mr. Murray, thank you very much, Mr. Forgy. Any other delegations not previously signed up and wish to be heard? There being none, we're gonna move on to purchases, and I'm gonna, just so everybody buckle up, because
Let's go.
I'm gonna rip through this. Recommendation to purchase 2021 Dodge Ram 1500 pickup trucks for the Public Works Department from Albany Chrysler Dodge Jeep Ram out of Albany, Georgia, in the amount of $52,880. Two bidders submitted bids, with the highest being $64,534. Funding is budgeted as follows: 5 storm drainage improvements equipment. Mr. Addison.
Thank you, Mr. Chairman. These are standard replacements. We recommend approval.
Any comments, questions, or discussion? There being none, we'll move on. Recommendation to accept the bid from the lowest responsible bidder, Reeves Construction, Inc., out of Albany, Georgia, to perform a street resurfacing and full-depth reclamation in the amount of $2,636,024.45 for the 2020 resurfacing project. Two bids were received, with the highest bid being $2,992,573.55. Funding is available in Spot 7, 2020 resurfacing, $425,000, 2020 LMIG, $435,823.69, and T-Splosh Road resurfacing, $2 million. Mr. Addison.
Thank you, Mr. Chairman. This is the standard annual resurfacing program. We recommend moving forward.
Okay, any comments, questions, or discussion?
How many miles? Thank you.
All right, very good. Moving on, recommendation to accept the bid from the lowest responsible bidder, HDS Construction, Inc., out of Albany, Georgia, to provide rock alley improvements in the amount of $186,800.08. Three bids were received, with the highest bid being $486,000. Funding is available in T-Splosh Road resurfacing, $480,000. Mr. Addison.
Thank you, Mr. Chairman. This is part of our T-Splosh Alley programming. We have alleys to be paved with asphalt, and alleys to be enhanced with rock. This is our first section for rock paving.
Very good. Any comments, questions, or discussion? There being none, recommendation to contract with W.J. Kirksey Construction out of Albany, Georgia, to provide renovation of the DOCO Facilities Management Building located at 219 North Washington Street for a total expenditure of $54,353. 3 contractors submitted bids, with the highest being $116,992.09. Funding is budgeted. SPOS 6 for $115,000. Mr. Addison.
Thank you, Mr. Chairman. This is to add a plan room and also another offices at facilities management, and we will contract the electrical work separately to save money. We recommend moving forward.
Any comments, questions, or discussion? Next, recommendation to rescind the award made on November 2nd, 2020 to Smith Built Buildings out of Dawson, Georgia, in the amount of $23,879.49 to install an equipment shed at the solid waste landfill. The vendor defaulted on the bid. Mr. Addison.
Thank you, Mr. Chairman. There were increases in materials, so the vendor was not able to honor his bid.
Okay.
Our fault, their fault?
Just an increase in material prices.
Okay. Gotcha.
Yeah.
Gotcha. So they weren't able to meet their bid specification.
Right, they weren't going to be able to do it for that price.
Understood.
There's more information in the next item.
Gotcha. Recommendation to accept the quote to install an equipment shed at the solid waste landfill from the next lowest responsible vendor meeting specifications that is available to complete the project. R&M Construction out of Albany, Georgia, in the amount of $32,500. The initial vendor defaulted on the award made on November 2nd, 2020. Funding is budgeted in solid waste capital outlay for $50,000. Mr. Addison.
Thank you, Mr. Chairman. We approached the second lowest bidder, and they were also in the same situation. Their bid was approximately $31,900. So we moved to the third bidder since it was still in the same price range, and they were able to honor this bid. So we would like to move forward with this vendor.
Okay. Any comments, questions, or discussion? Being none, recommendation to accept the bid from the lowest quoted vendor, Quality Painting Contractors out of Albany, Georgia, in the amount of $36,300 to upgrade the Horace King overlook roof and deck and paint surrounding areas near Turtle Park. 2 vendors submitted quotes, with the highest being $53,506. Funding is available. SPOS 7. Mr. Addison.
Thank you, Mr. Chairman. With all the recent improvements to Turtle Grove Park area, we want to enhance the surrounding decks, pressure washing, repainting the rails that need to be done, upgrading the Horace King overlook, repairing all the rotten wood that needs to be done, restaining it, putting a new metal roof on the area, and pressure washing the sidewalks all the way down towards the restroom area. We think this would be a great enhancement for the park, since we're spending so much money on the actual park itself, and it will make the whole area more enticing.
Good for the springtime. That's good for spring.
Mm-hmm. Very good. Thank you. All right. Any comments, questions, or discussion? There being none, additional business, recommendation to approve the alcohol application for Victoria Field Farms LLC. Joe Harris Morgan, the third licensee, DBA Victoria Field Farm at 5626 Walker Dunker Station Road for beer. Brewers, the Albany Dougherty Marshal's Office recommends approval. Chief Anthony Donaldson, Business and License Support, is present to address. Thank you. This is so they can serve beer out there.
Yes, sir.
Yeah, okay, I got it. I don't see any need for him to have to come to a meeting in order for us to vote on a brewery being able to serve beer. Recommendation to accept the proposed ordinance allowing Dougherty County to be a broadband-ready community. Mr. Forgy and Mr. Lee.
Hello again. Hopefully you've had the opportunity to look at this ordinance. The purpose of it is to establish a procedure for broadband, dealing with broadband proposers, installers in the community. The ordinance really, all it does is it establishes a single point of contact that the county has designated, so anyone wanting to develop broadband knows who to contact. It also develops an application process that sets the maximum time the county can review a proposal at 10 days, and it establishes fees as well for applicants. This is part of becoming a broadband-ready community, and this is I guess, there's two components to that. You have to adopt this ordinance, and you also have to include a broadband element in your comprehensive plan. And we are working on that. Your comprehensive plan, there's a 5-year update that was initially due the end of June, but because of COVID and other delays, the deadline has been extended till the end of October. We are on schedule to completing that update, which will include the broadband element. So at the time you adopt your comprehensive plan and this ordinance, then you can apply to be a broadband-ready community.
Excellent. All right, very good. Any comments, questions, or discussion? Being none, we're going to move on. Thank you very much for all of your hard work today. Recommendation to take appropriate action to either demolish or bring up to code one purported dilapidated structure located at 3422 Sweetbriar Road. Mr. Lee.
Yes, Mr. Chairman, you'll have a resolution for your review next week, and a copy of it's in the file relative to 3422 Sweetbriar. You'll be requesting that the Code Enforcement Office go out and take a look at this and do a write-up on it. And if it looks like it ought to be demolished, then I'll file a petition in Superior Court to have that done. You'll note that Section 5 of all of the resolutions relative to all of these properties reads that the county attorney, public officer, and county administrator are hereby authorized to expend funds necessary to have the violations abated, including demolition costs. And of course, the reason for that is in there that you've set aside $50,000 for demolition costs on dilapidated homes. And with each one of these resolutions, you're authorizing the demolition cost to be paid. So, but that'll be on your agenda for next week for the resolution.
All right.
Oh, Mr. Chairman, also I put a picture of the dilapidated home.
I saw that.
Okay, that's that particular location that's in your package.
It's definitely dilapidated. I think you can remove the word purported from that, but I understand why we do that. All right. Any other comments, questions, or discussion? There being none, Mr. McCoy.
Yes, sir, Mr. Chairman. Thank you. One item. I want to remind everyone of the ribbon cutting on a renovated Heath Park for Thursday at 11 a.m.
Thank you.
All right. Very good. Anything else, Mr. McCoy? All right, very good. Mr. Lee?
Nothing, Mr. Chairman.
All right, very good. Commissioner Gaines?
Nothing, thank you.
All right. Commissioner Jones?
Nothing, sir.
Commissioner Newsom?
Nothing, Mr. Chairman.
Commissioner Johnson?
Nothing further.
Commissioner Edwards?
Nothing, Mr. Chairman.